Welcome back. I'm joined now by Dr. Mike Gorman with Trailhead Clinics for our Share the Health segment. So this one, we have an interesting topic this month. We were actually talking about it here the other day. We're talking about prediabetes. So what actually is prediabetes?
So prediabetes is a term we use for people who have blood sugar levels that are elevated but not high enough to meet the criteria for diabetes.
Mm-hmm. So what does that mean in terms of not then going on to develop diabetes? Do you have to cut down your sugar levels?
Right. So the approach or the treatment for prediabetes is really healthy diet and exercise. The American Diabetes Association actually recommends that people with prediabetes be referred to what's called an intensive lifestyle intervention program. So that's really the treatment. Sometimes we'll prescribe a medication called metformin, which is fairly common, but that's usually reserved for patients who are either over 60 years old, are overweight with a BMI of over 35, or sometimes in women who have a history of gestational diabetes.
Okay.
But otherwise, the treatment really is lifestyle intervention.
Mm-hmm. So then how is it actually diagnosed? What is the test you take for it?
So there's probably 3 common tests that could help diagnose prediabetes. The first one would be just a fasting blood sugar level. Mm-hmm. The other test is what's called an impaired glucose tolerance test. And the third test is a test we commonly do in our diabetic patients called an A1C. All 3 of these tests are simple blood tests that can be done in the doctor's office.
And then, okay, so there's a certain range of the results that you would get back that would say you're leaning towards pre-diabetic.
Correct. So the first one, the fasting blood sugar level, anything between 100 and 125 would fit in that category for pre-diabetes.
Okay. And then so what happens if you're diagnosed with pre-diabetes and you don't go on and change your lifestyle?
So again, pre-diabetes is often associated with obesity, but it's also associated with high blood pressure, high cholesterol, high triglycerides, and so people also need to be screened for those conditions as well as for tobacco use, because all of those conditions increase your risk for cardiac and other vascular disease.
Mm-hmm. So all of these sound like, you would get it done, these tests done once you're a little bit older, but is there an age, can any age be diagnosed with prediabetes?
It's more common in adults, but it's possible at any age, but we don't see it too often in younger people, even though we're seeing an increase in diabetes. We typically think of prediabetes in adults who are a little overweight, maybe not exercising or eating like they should.
Wow, all right, well, thank you so much.
You bet.
We'll have all this information for you on westernslopenow.com, and don't go anywhere because we're going to take a quick break.